Okay, it's 4 o'clock by my watch. Let's call our meeting to order. Are there any public comments? Anyone from the public out there that wants to bring an issue before the board? Please make yourself known.
There are no
Michelle?
hands raised.
Thank you, Michelle. There seems to be no one out there right now. We can try again later. The first thing on the agenda is, well, first of all, we need to look at our agenda. And we're going to add an item, and that'll be down under E. And it'll be number 2, is we're going to review some board regulations.
Which ones? They seem numerous.
There's a couple that we need to review since students are coming back and we're moving from different colors and so forth. Anything else we need to add to that agenda that you know of, Penny?
I don't think so, unless there's new business later on.
Okay. Now let's go down to the approval of the January 5th meeting minutes. Anybody find corrections?
I found a couple typos. Under the Health Net bullet, the next to the last line, Dr. Laban's name is misspelled.
Yeah, we spell that name
And then
LAA and LBB and LABO.
And then the very next line, it says, however, he does, and I think it means if he does.
Well, that first one is not really a sentence. If Dr. Laban is given a direct partnership with the health department, and then it stops. So that's not a sentence.
Right.
And his name is misspelled.
Okay.
And then they go down 3 lines. They operate under the same rules as Health Net does. They are out. Does it sound a little better to say they operate under the same rules as Health Net and are accredited by the same organization, the Health Resources Service?
Better.
Mm-hmm. And then if you go on down another 2 or 3 lines, is Centerstone one word?
Yes.
Okay, that's 2 words there. The CEO is Centerstone.
I might ask a technical question, and I know we've got HealthNet here with us. HRSA doesn't accredit, they fund, right? And as part of their funding, they have certain regulations. There's accreditation is voluntary, so I take exception to the word accreditation. And Misty, if that's not correct, then let me know.
Now,
we have a fire alarm going off here. I think it's some kind of an alarm.
All right.
So we're checking.
Okay.
Just a test.
What?
Testing.
Okay, just a test. We're getting flashing lights in here, and okay, just a test.
Is this an omen?
Yeah.
Okay.
So
Also-
they're funded by HRSA, not accredited.
Yeah,
Okay.
correct.
And then if we go down to the last 3 lines, the next meeting is to have HealthNet attend. I don't know what we meant with those last 2 lines. How do we want to change that?
Why don't, here's one option is we can go back, because we've had several people's hands in these. So let us go back and then just take these notes and bring back a clean copy at your next meeting.
Well, then the one other thing was under staff, the bullet staff reports. Line 5 says sued, and I think it means used.
Yeah, used.
Okay.
It took me 3 or 4 times to read that and try to figure out. I was trying to think who's been sued.
I just now see under Roman numeral 6, there's a couple of typos there that ought to be corrected.
Okay.
And also in the farmer's market bullet, about midway where it starts out this case, I thought we might say this case would allow vendors 2 or 3 licenses for 2 or 2 or 3 locations, all with a one-time fee.
So will we just defer the approval of the minutes until the next time we're able to?
That's,
Is there anything? Okay, is that all right with everybody that we just defer them until later on?
Sure.
Okay, thank you, Danny. Thank you.
sorry about that.
Okay, one of the things we're supposed to do is to introduce ourselves to the public in case there are any public that's attending. Do we need to do that if there's no one attending the meeting? Do we know? Margie?
There's no legal requirement for you to introduce yourselves, but certainly you can if you want. And I think it's a nice practice.
Okay, welcome, Ashley. We just have looked at the agenda and we're gonna have the minutes brought back to us.
Okay,
Well,
sounds good.
do you want to introduce yourselves? I'll start out. I'm Kay Leach. I'm the chair for the health board. Ashley, you want to introduce yourself?
Sure. Ashley Craner, and I'm the vice chair. I've been on the board about, I don't know, a decade or so. Good to be here.
George?
George Hageman, retired microbiologist from Indiana University, a member of the board for many years.
Okay. Mark?
I'm Mark Norell, and I'm senior lecturer in healthcare management and policy at the O'Neill School of Public and Environmental Affairs at IU. And I live in South Monroe County.
Steve?
I am Steve Pritchard. I'm a retired clinical dentist. I still am active in dentistry in other ways, but I've been on the Board of Health for a long time, 15, 20 years.
Just
but
got reappointed.
not as long. It just got reappointed, not as long as some others, though. Yeah, thank you.
Carol?
I'm Carol Taluki. I'm a retired pediatrician. I've been on the board slightly less than George Hageman.
Bob?
I'm Dr. Robert Wren, retired obstetrician and gynecologist. I've been on the board for about 4 or 5 years, I believe.
Time goes by quickly.
Yes.
And our administrator, Penny?
Penny Cottle, administrator of the health department, and Dr. Sharp is here.
Dr. Sharp, I'm the health commissioner. And I've been
Dr.
on,
Sharp, would you show your face so people would know what you look like?
and I've been the health commissioner since the summation of all your times. Hi.
Yeah, how many years has that been, Dr. Sharp?
It's been almost 44 and a half.
Oh, my God.
He's
think I
got
have-
us all beat,
A little history behind me, I think.
I think. And with us today, we have Misty. Misty, would you like to introduce yourself to the board?
Hi, everyone. It's nice to meet you. I'm looking forward to being a part of the conversation today. I'm Misty Lewis. I'm the director of the HealthNet Foundation.
Okay, and Margie, I haven't forgotten you. We have our legal person here today that helps the board, Margie Risen. Margie?
Hello. Hi, I'm Margie Rice. I'm one of the county attorneys and I'm assigned to the health department. Thank you.
Margie, we just did our board self-assessment, and I wanted you to know that several of the board members had said one of our strongest points has been having you on the board.
Thank you.
We really appreciated it.
I
And it was
appreciate being here. I appreciate it. Thank you very much. And I appreciated you asking Dr. Sharp to identify himself. It's sort of like he's like Oz behind the scene, the voice. And so for the public to see his face and know he exists was helpful. Thank you for that.
Well, when you're in the same room and you've got that 6 foot distance you have to maintain, it's hard to be side by side on the screen. Also, we were going to have Jaima Kelly from the Public Health Clinic. Is she here today?
You know what? And I forgot to tell Michelle that, so she may be hanging out. We'll see.
And is Misty here? She was going to be with us today from the HealthNet.
She just introduced
Oh, Misty
herself.
already talked to us. It was Misty was going to be with Shelley. Is Shelley here?
Yeah. Shelley was having a hard time getting on. She was listed as an attendee, which she's on now. Is there a way to make her a panelist?
Michelle can do that.
Okay.
I just need to know what name I'm looking for.
S. Solis.
Okay, did I get everybody? I think so. Okay, that's who we are. Let's go down now to public health reports, and our first report is from HealthNet. So, Penny, would you like to give us a little background on our inviting HealthNet here and why they're here today?
Certainly. So for more years than I can count, and Dr. Talukian may be able to give us a better time, or Dr. Sharp, but for many years we have provided funds for prenatal care for people who were underinsured, uninsured, people that fell through the cracks, if you will, non-English speakers. We had that arrangement, I think, with the CHAP clinic, and then it was Volunteers in Medicine. And then just recently, this past year, we signed that agreement with HealthNet as Volunteers in Medicine became HealthNet. And it did take us a little while this year to get the agreement signed and processed. So it was a little slow in getting all of that processed. And so normally they would give a mid-year report and then a end of the year report. And we didn't get the contract signed until July, I think. And with that, in the midst of COVID, they are here today to give you a report of the number of patients they've seen, what the process looks like now, because it's slightly different. I did meet with them a week or so ago to kind of talk about that and review that. And I think that certainly they're serving patients well, and they can address some of the questions that we had at the last meeting. So they are here to give you a report and answer questions that you have on the prenatal services.
Well, I see Shelley's with us. Thank you, Shelley. And Misty, are you going to begin?
Yeah, I'll start out first. Thank you so much, Penny. So with the health, I will mention that HealthNet Inc. is a federally qualified health center, but then there's the HealthNet Foundation, which is the philanthropic arm to HealthNet Inc. So basically we're a separate 501c3, and majority of our dollars, our fundraising goes back into supporting the programs and services of HealthNet Inc. So we were established back in 2018, and we focus on 3 primary areas: education, access to care, and addressing food insecurity. And so we were super grateful to receive this grant funding for prenatal care, in which so far we've been able to see or meet the needs of 10 patients, 8 of which have selected Dr. Laban for their prenatal care, in which 3 have delivered and 2 are seeking care from IU Health. So thus far with the grant, we have spent $4,986, which is about 33% of the full grant amount. So I'll just tell you a little bit about the process. So if a patient comes to HealthNet and they need financial assistance, helping to cover their medical expenses, they will fill out the application for assistance. That application comes directly to the foundation, and then we have a subcommittee. That subcommittee reviews each patient application, and we basically look at 3 different areas. We look at whether or not the patient falls below the federal poverty rate level, or if the patient doesn't have insurance. And so once that's determined, then we push the applications to our full board for final approval. Once the board has made final approval, we release the check to the provider of the patient's choice, and that check takes about 7 to 14 days to clear and get to that healthcare entity. So are there any questions about the HealthNet Foundation, the patient process?
I have a quick question. So from the time that the patient comes in to the time that the check is released, so it's going to the patient and then the board and the doctor, about what is that time frame?
So it really depends on how quickly the provider releases the bill to the patient. So it's hard to tell.
Okay, but and while the patient's waiting on the funds, though, it doesn't get in the way of care.
No,
Okay.
absolutely not.
Okay, that's kind of, I guess, where my question was going. Okay, thank you.
You're welcome.
So this process applies to all HealthNet patients, or are we just referring to the OBs now where it would go to the foundation?
So this is for all patients. So even it's the same, we use the same process even for our patient assistance funds. So we have other funds and it's very similar. So it's across the board.
So the foundation is essentially funding the HealthNet provider, underwriting the provider and paying for private providers, right? I mean, does funding go, I understand funding goes to the private providers, but does it go to the HealthNet? Is the HealthNet organization separate than the foundation? Or
Yes.
is it all? Yeah, okay.
Yes. So the foundation will support any patient. So based on wherever the patient is receiving care, then we're willing to pay on those patient bills as long as they fall within our criteria. But we are completely separate from HealthNet.
Right.
Your foundation, excuse me, does your foundation try to qualify these patients for Medicaid?
So no, that would be on the health center side. And so Shelley's going to talk a little bit more about the clinical aspects.
Why don't I go ahead and address that?
Absolutely.
What happens, this could be an existing patient, it could be a new patient, who knows? They come to the clinic, and I'm just going to talk about our OB patients because that's what's relevant here this evening. The first thing we do is once we find out they're pregnant, we make sure that they meet with an enrollment specialist. So we have on-site navigators that will meet with them. They will verify that the patient has emergency Medicaid. The people that are receiving funds from this don't qualify for any other insurance except emergency Medicaid. So we will make sure that they qualify for that. If they haven't already applied for it, we will help them on that day apply to get on emergency Medicaid. If they're already on emergency Medicaid, then what we will do is fill out a form that's necessary stating that they are pregnant, then that's sent to Medicaid, and then they get on what I like to refer to as pregnancy Medicaid. There's a different name for it, but for whatever reason, I never can remember it. But it makes sense to me that it's pregnancy Medicaid.
Presumptive eligibility?
Pardon me?
Presumptive eligibility?
No, these patients do not qualify for presumptive eligibility. So they only qualify for emergency Medicaid. Emergency Medicaid only covers a true emergency that is presented through the emergency department. Once they get on what I'm referring to as pregnancy Medicaid, then the pregnancy Medicaid will only cover the delivery of the baby and I believe it could be 2 appointments with the OB doc after the delivery. So what the grant is covering is prenatal care for these patients because prior to that, they would not get any. So what happens after we go through that. And this is all sort of happening the same day that they're here. We refer their name to an RN, an OB-RN in Indianapolis at HealthNet. She will then call the patient and do a gather health information from her and ask more information, questions they have, if she wants any referrals to local resources. And then she will schedule an appointment with our nurse practitioner / midwife here in Bloomington. So that will probably happen within a week. She will then have an appointment with the midwife. The midwife will then do a gather again all of her medical history, review all of that with her, and then order the necessary and appropriate OB labs at that time. Then we schedule a second appointment. Typically it comes within the next week after we've received the labs. And then the midwife will do a complete physical, a pap smear, review all of the labs with the patient, and then refer or send her to the OB that she has chosen to see. Then we send all of the lab results, progress notes to that provider. So it's a process. It can be very quick. I will, our patients have complicated lives, and it's not unusual for them to miss appointments. It happens. It's not just our OB patients, it's all patients. So it's not unusual for us to have to reschedule appointments numerous times. And I was reviewing charts, and we're very good at documenting and following up with patients. And we do it until we get a hold of them. And that can take many, many calls. And then the other thing that we see with some of our patients is some of them, they've had multiple pregnancies. They're quite comfortable and don't necessarily see the need for prenatal care. So we have to do a lot of educating with them and spending a lot of time helping them understand that, which our nurses do. They're very good at it. Did that answer the process question for you?
Am I correct that all of the lab work is done here in Bloomington?
Yes, yes. We have an on-site phlebotomist with LabCorp, and the patients do get their labs done here, which is wonderful. It's very convenient for them. We walk them down the hall during their appointment, so it gets done typically the same day. That's just wonderful. And then when we refer them out to the OB, if that provider orders labs, they can send it to us and we will send it to LabCorp so the patient can get the labs done here if they choose. That's again their choice. But we have found it significantly less expensive, and the patients prefer to come here.
Shelley, can you address the concern that Dr. Laban had concerning labs? I'm not really clear on it. I didn't ever do labs, so that kind of lab anyway.
Sure. Well, yeah, probably not. I can. He's had a couple of concerns. One, he was, for some reason, was receiving the bills for some of the patients, and I know that was really upsetting to him. That was, that was an IT issue. We were trying to make sure he was receiving copies of the labs, and he would also get the bills. But that was resolved. That was resolved very quickly. I most recently found out that he was concerned because he felt he stated he wasn't getting the lab results. So I contacted LabCorp immediately, and they checked with their IT people. They gave me a list that showed all of the lab results did in fact go through. I also checked with our IT people as well as our EMR administrator or manager to make sure that our faxes were in fact going through, because they all show that they have been sent. So I don't know. From our end, it's going through. From health or from LabCorps, it's going through. They've all reviewed it. Dr. Laban's office has my cell phone. Anytime they can call me, I will walk down the hall and say they didn't get it, which I've done. They didn't get whatever it is they're needing, and we will send it and fax it right away. It's very important to us that our patients are getting quality care, not only here, but outside of our clinic. And I just really want to make that clear. This is extremely important to us. And not just the Bloomington Clinic, but HealthNet in general. I want to make, we chose to merge with HealthNet because they shared our mission at VIM. And I have to say, all of the staff that worked at VIM are now working here for HealthNet. It was a good marriage, we like to say, and we're learning a lot. Learning all of the rules and regulations for HRSA is one thing, and I have to say that we recently had a review and an on-site evaluation where they came through the clinic, and we passed with flying colors. Now, we are brand new in this world of federal regulations, and that was great. And the reason we passed was because of the support that we get from HealthNet. It's very important to them. But more importantly, that I think, is that we are Joint Commission approved. And for those of you who know and understand that, that is a very difficult regulation to follow. And it kind of blows my mind every day what we have to do. And I personally am still learning a lot about it. But not only are we approved, we've gotten their golden standard of award, and I think we've done it several times. So it's very important to HealthNet in Indianapolis that their Bloomington clinic be successful, and that we follow all the rigorous rules and regulations to meet the standard of care. And that includes seeing patients in a timely manner and providing the best and highest standard of care. And it's reviewed. Anybody who's been involved with Joint Commission, it is reviewed. And I feel very blessed and very lucky to have the support that we have from HealthNet to make sure that we are meeting those standards. So that's maybe a longer answer than what you wanted, but I think it's really important to understand that the patient care is very important to us.
Nice presentation.
Yes, thank you. You know, I might want to put some history on this whole thing, because as Penny said, I was around, you know, when all this, when this little piece of funding happened. And what was happening back when that happens, there's that select group of patients who will not qualify for Medicaid other than emergency Medicaid, and have no other source of insurance. And most of those at the time were non-English speaking.
Right.
And we're never going to qualify, I mean, for a variety of reasons, we're never able to qualify for anything other than emergency Medicaid. And so they were kind of falling through the cracks. And that was our concern. and at the time, they were having difficulty getting into any OB office to get prenatal care.
Absolutely.
So Dr. Laban stepped up to the plate, you know, bless him, and said he'll do it. We made a negotiate this little deal with him. He said he would see them for this amount of money. And so we, you know, we have a little fondness for Dr. Laban, because he's worked very hard and has provided for this population.
Absolutely.
And so I think the concern, especially for people like me who, you know, were involved with it when it was negotiated, is I want him to be happy.
Right.
You know?
Oh, we all do. Yeah.
Yeah. And I want to make sure that he's getting. I mean, again, you know, he's not a big practitioner like IU Health, so he doesn't have a lot of the other resources. So
right.
Yeah, I think our concern is that he seemed very unhappy, and we wanted to make sure that things are working for him. And that this very select population, this very important select population, like you said, doesn't always value prenatal care and get things done.
Right.
And we do our best to make sure, for the obvious reasons, which are that if you get prenatal care, you get better kids, you know,
Yeah.
healthier kids. And
Yeah.
and in the long run, it does save us money. About
Right.
13 to 1.
Yeah, absolutely, absolutely.
So there's really good, you know, it's financial reasons, and also it's compassionate reasons for wanting to make sure.
Yeah. And you know, it's been a difficult year for everybody, and I hate to always blame COVID, but doggone it, it's COVID's fault in many ways. We had, it became difficult to, as Penny had said, to get the agreement signed in a timely manner. Again, I don't think that's anybody's fault. It was a situation and people were doing what needed to be done. But that didn't prevent us from getting pregnant people who came in the door that needed care. And at that time, Dr. Laban was, he was uncomfortable, which I don't blame him, because an agreement hadn't been made. And so he was not yet willing to see patients, which was fine. My goal and our goal here is to get patient care for these patients, no matter what. Providers were not willing to see our patients. As you said, that is a challenge. IU Health is now, they are seeing some. What I did was I reach out, I'll give you an example. I had a woman that walked in, a young woman, 37 weeks pregnant, and she had not had any prenatal care. We got her with enrollment specialists. They got her on emergency Medicaid, or they enrolled her in emergency Medicaid. And I called our OB director in Indianapolis and said, this is what I've got, and I have no one who's going to see this young woman, and she needs care. And she said, I'll see her tomorrow at 1 o'clock if she can get up there. I gave her a gas card. She had a friend that could take her. She went up. She got her exam, she got an ultrasound, she got all of her labs done. And then she said, I'm going to deliver in Bloomington. And I was able to then send the labs, all that information to Bloomington Hospital so that it was there, ready and waiting when she did go in deliver. And 2 weeks later, she did. That is something we couldn't have done with them. We just didn't have those resources. So that was wonderful, and it took care of people here in Bloomington. And you know, you do what you have to do to help these folks. The circumstances are not perfect. It's not always the way you want it to be, but we have the resources available to reach out and get the support we need. And I think we're very, very lucky. I'm very happy that we did this merger. Are there other concerns that I can address?
I have a quick question.
Sure.
So I find that a little upsetting that we don't have enough partnerships here in Monroe County to assist this population. And it also, I mean, with 10 patients, it doesn't seem like we're getting a lot of referrals either. What are you guys currently doing to help kind of foster more partnerships with the OBs and with other organizations to get referrals to you guys?
Yeah, actually, I think we do have good partnerships in the community. And I think that's one of the things that the VIM clinic had that has continued with HealthNet. I do think, again, I hate to say it, but COVID has stopped a lot. We can't do a lot of health fairs. We can't do a lot of personal meetings, but I'm in Zoom meetings with people from IU Health. There's not a lot of options in Bloomington. It seems like most of the OBs, if not all of them, except Dr. Laban, are connected with IU Health. IU Health has agreed to see our patients. It is very important, and this is part of being part of HRSA, is we need to give our patients that choice. And they can look at the list and they can decide who they would like to see. And that's what we encourage, and then we will work with with whoever they have chosen, assuming the patient or the provider is taking new patients. So I do think we have a good relationship. We traditionally have not had a huge number of OB patients in this population. If they qualify for insurance, we get them on insurance. So that's why you're not seeing it here. These are folks that really don't qualify for insurance at all and can't get prenatal care from that. Did that answer the question?
Well, I guess it's just been a long time since I've had my babies. So, because it seemed like back then, you know, but I hadn't really thought about it that I guess Monroe County is becoming more consolidated.
Oh, yeah.
In terms of the medical and, yeah, that could pose challenges. You know,
challenges and advantages both. But
well, both, right?
Yeah, but
both.
actually, there's never been more than what, maybe more than 15 patients a year.
Well, no, I kind of meant like, yeah, no, I know that. Like some years it's even less than that, but or less than 10. I guess I meant like reaching out with the partnerships in the community to get, because sending one to Indianapolis, and you said it was difficult to find anybody to take her. And I'm like trying to think about this going, well.
It's not unusual for providers to not want to take on a patient at 37 weeks with no prenatal care. I hate to say it, but we dealt with that.
It's important to know. I really, thank you.
I was happy that we were, and that I found someone. It's interesting, you know, giving patients choices, which we didn't have that opportunity of them. You know, we had somebody, okay, this provider has agreed to work with us and this is kind of your choice. You can go with someplace else. But being able to have the freedom to give them choices, I was shocked. We haven't had that many, but we've had 2 or 3 that actually said they preferred to go to Indianapolis to a provider in Indianapolis. There were various reasons. They had family up there. One, her boyfriend lived up there, so they felt it was more convenient. And another one said she really, really liked the provider and wanted to continue to do that and was excited to deliver at Methodist Hospital. Not everybody feels that way, but she did. But we were able to allow her to do that, and I thought that was really good.
Was there language
with us?
With the patient? Did she have a language barrier?
We have bilingual staff here. We have a bilingual nurse practitioner. We also have a language line that we use, but our enrollment specialist is bilingual. We have 2 people up front who are bilingual and trained interpreters. So on site, we're doing really well with Spanish. We have to use the language line for any of the other languages. So it really hasn't been an issue. And we also do cultural competency training. All of our providers go through that to have a better understanding of, 1, working with people in poverty, and then 2, how to work with people from other countries, different cultures, and their views on medicine. It can be very different, and how to approach that respectfully, yet get them good care. It can be a challenge. It can be walking delicately sometimes, but we have a good supportive team. We meet and review cases together. And I think we're doing a pretty good job.
If I could, now our contract between Monroe County and now with Health Net Foundation is kind of structured around a per pregnant one, per prenatal and delivery occasion. But maybe the communication between our board and Health Net would be along the lines of, if that ever sort of, you know, like Ashley was saying, that she's kind of concerned about making sure that there's promotional, I don't know if promotional is the right word, but at least letting the community know and outreaching to those who could take advantage of that. And you know, if the contract, if you get the sense that you could do more outreach and do better good in the community, if somehow that contract were looked at from that standpoint, that I think we would be open to thinking about that, you know, because we're sort of the department's got to go through the Board of Health with
Sure.
regard to annual budgetary allocations. But even bigger than that, I would say this is we're talking about obstetric services, but Health Net does across the board, all different kinds of healthcare services.
Yes, we do.
And this is our effort to maybe say, like, you know, this is a good starting point for us to say, we want to hear from you guys, not just about OB, but we want to hear about all kinds of, you know, the spectrum of healthcare, medical care needs in our community that are not being met.
I would be happy to talk about it. I really would be. Yeah.
Right. And that's not to say that, you know, we can't, you know, we don't have unlimited funds and
No, yeah.
you know, maybe Penny's having a heart attack here, but this is something that more information about this is better.
Yeah. Well, you may get me going and I can't stop, but this is near and dear to my heart, and working with these people. I am on the City of Bloomington Commission for Hispanic and Latino Affairs and have been for a while. And part of that is for me to bring the healthcare issues of that particular community and make it more public. And that has also allowed me to meet a lot of people. Now, the VIM Clinic and now HealthNet has always worked closely with El Centro, and we have a very good relationship. If they come across somebody who's pregnant, they walk them here and they're in the building and they really make sure. And in fact, one of the things that's really exciting is that I called Maritza, who Steve knows, and she is now the director of El Centro, and she used to be an RN with the VIM Clinic, and she's just wonderful. But I called her and I said, we've got all of these women that are Spanish speaking and they're pregnant around the same time. Can you do a program for them? Just a support, how are they going to get through this pandemic together? And so she is actually trying to do Zoom meetings with them. Now, again, just like everything, they come and they go, and maybe one's there, maybe two are there, but she's doing Zoom meetings to give them support. So I think that's awesome. I love that. We also work with the Refugee Network, and that is a group that is really working hard with refugees that are coming into our community. And that can be Uyghurs, that can be people from South and Central America. It could be a lot of different groups, and they are bringing people in. So we are, as best as we can during a pandemic, reaching out to this group, and we'll keep at it.
Penny, do you have any other questions?
I don't have a question. The one thing that I would add, and as we said, I did talk kind of to Centerstone, you know, about their services, but HealthNet is really the provider that sees the population that these funds are really set aside for, if you will, and they're in the best position, I think, to make those referrals. We talked about that at the last meeting in terms of how would referrals be made? How do we find these individuals who qualify? And I think that that's because they're already patients at, I started to say volunteers in medicine,
Yeah.
at HealthNet, or they have connections to people who can make that connection to HealthNet for them.
Mm-hmm.
Yeah, absolutely. Yeah, that Centerstone Health Services this is not their core patient population. No, HealthNet is definitely much better suited for this type of grant. So do we need to make any kind of particular action to continue this at this point?
You know, I think that from a practical standpoint, Margie can chime in on this. From a practical standpoint, when you approved the budget, you approved this, and what we submitted was to HealthNet. So I don't think there has to be, although I think just given the conversations that we've had, it would make sense for you all to, probably take a vote to just continue this contract for 2021, and then we'll make the date changes and those kinds of things that we need to make in there.
I'll move that we continue the contract with HealthNet to provide for the prenatal care for this population.
Not
We have
second.
a motion. We have a second now. Okay, we have to do this by name. Cranner,
Yes.
Hedgeman,
Yes.
Norrell,
Yes.
Pritchard,
Yes.
Talukian,
Yes.
Wren,
Yes.
and I'll also vote yes. We really appreciate Misty and Shelley. We appreciate you. It's very informative and it helps us a great deal. So thank you for coming today.
Thank you so very much for listening to us. And I am happy to answer anybody's questions or concerns. Please feel free, pick up the phone. I like to talk about the clinic, so I'm happy to answer any questions.
Yeah, thank you everyone for having us. It was nice to meet you all.
Thank
Thank
you. See you guys.
you.
Nice to meet both of you.
Okay, bye-bye.
Bye.
Bye. Okay, next is Public Health Clinic, and we have Jaima, is that right? Did I say your name right, Miss Kelly?
It's pronounced Jama.
Jaima, okay. It just looks different, you know?
Yes,
That
it's an unusual spelling.
Yeah, Jaima. Okay, Jaima, it's your turn.
All right. As far as
Would you
the,
like to tell us? Yep.
What?
I'm sorry, I think somebody had a
Jana?
question.
I think Kay froze maybe for a minute. So yeah, Jana, go ahead.
Okay. I'm Jay McKelly. I'm the charge nurse for the Monroe County Public Health Clinic, which is a collaboration between IU Health Bloomington Hospital and Monroe County Public or Health Department rather. And I just want to talk a little bit, mostly I'll talk about our COVID vaccination clinics. In the meantime, we are keeping our normal business open to patients to be seen for appointments in our clinic. But obviously our big news right now is our COVID vaccination site over at the Convention Center. We are into our third week now of vaccinating. We have appointments available on Mondays, Wednesdays, and Saturdays now. And this is all kind of dependent on the number of doses that we have allotted to us. We were discussing possibly opening on Fridays as well, but at the time, there's not enough vaccine allotment for us to be able to open for another full day until that expands. But the clinics themselves are going very well. We're getting a lot of positive feedback from people who are coming in, getting vaccinated about how well organized it's been. And people are very grateful to be able to be there and get vaccinated and get protected.
Jamie, I'll second that.
I will too. I went to the clinic at the Medical Arts Building. It was fantastic. And I really want to give a big thank you to all the volunteers.
Yes, absolutely. We have some fabulous, phenomenal volunteers working with us. And I couldn't be more thankful for them. That's for sure. Let's see. What particular questions do you have for me? I didn't really have a lot of talking points prepared.
So have you had any trouble having vaccine for the second doses? Because I know a lot of people who've gotten the first are really concerned about having vaccine availability for second doses.
I know there's been some talk about that in the news. I have not heard that there are going to be shortages that would prevent us from doing second doses. The schedule is controlled at the state level. So the Indiana Department of Health opens our schedule based on, the vaccine that we have available. And at this time, they think they are holding a certain number of appointments for second doses, and then having a more limited amount of first appointment slots available, knowing the importance of people getting those second doses, in a timely manner, as close to 4 weeks afterwards as possible. We are giving the Moderna vaccine at the convention center. And that one is 2 doses, minimum 28 days apart. So as far as I know from what the state has told us, we will have enough for those second doses, and that's kind of being controlled on that appointment schedule.
So Salita, so the state's telling you how many doses you're going to get, so how many people you can schedule, and they're actually their software is running it. It's not local.
Right.
Okay.
We communicate with them as far as what our capacity is, how many people we can, see in a day. And then they open those appointments up based on that, as well as the number of doses that they allocate for us each week.
Yeah, it's interesting because when the thing came out yesterday that 65-year-olds could get vaccinated, a number of my friends got right on it, and they could get an appointment this week in Brown County, but had to wait till after February 22nd for Monroe County. So I thought that was interesting.
However, I do know someone that got an appointment on Friday at Kroger, and that he just made the appointment, I think, yesterday.
Kroger just came on a week, maybe 10 days ago. But the benefit is that the state does not allow any of us to make appointments, or the idea is that no appointment will be made that there isn't vaccines to vaccinate that person. So when you've heard other states or places where people have stood in line for hours and then told, oh, we don't have vaccine for you, that should not happen, because we are requiring the appointment. And that's part of why you can only maybe have appointments 2 weeks out, because that's how much vaccine is there. And then as more vaccine is pushed out, then those appointments open up.
I have 2 questions. One is, how many vaccine sites do we have in Monroe County? And then the second one is, have we even had any leftovers? I know that there's a wait list out there that people can sign up on. And so I'm just kind of curious if we're using 100% of our allotment. And then the other one is, how many sites do we currently have?
So currently in Monroe County, I believe we have the convention center site that's set up through the health department. And then there's also the Med Arts building located next to the hospital. That's the hospital site that initially opened in Monroe County. And so their capacity is a lot bigger than ours. But people are able to schedule at either location. Whenever they go to schedule an appointment, they put in their zip code and it gives them the locations that are closest to them. Now, the Zotec platform that we are using to schedule right now, I believe only has those 2 locations in Monroe County. Kroger is doing, and Penny can probably help me with this one, I think Kroger is doing its own scheduling system.
They are, but when you go to schedule, so if you go to the vaccine site to schedule an appointment, you'll see the map and it will list out all 6 locations for vaccine. So 4 of which are Kroger, 1 is the Med Arts Center with hospital, 1 is us at the convention center. And then when you click on that, then you essentially go to the platform to make that appointment. So if you choose to go to Kroger, then you're going to get their platform and make it in terms of what they have available. And
I just talked with someone this morning who said she had done the Kroger, and she said, quote, it was a zoo, and that she waited in line a really long time. and that she was helping other people to get on, but she didn't get on. And I assume this was yesterday, and she said she's going to be vaccinated tomorrow.
In terms of vaccine, the other thing that I would say, and Jama, I've worked with Jama, but I also know, Sally's been there Saturday. So when we start the day, we do not, if we have 200 appointments, we do not start the morning with 200 vaccines drawn up. Those are drawn up as we go through the day, so that the goal is at the end of the day, we don't have any of those extra doses that people refer to. The challenge is that each vial of vaccine has 10 doses, and correct me, Jana, if I say anything wrong here, has 10 doses of vaccine. Sometimes we get an 11th dose out, and we heard about that happening with Pfizer. We're finding now that it sometimes happens with the Moderna. So if you end up at the end of the day, you may have to open that vial to do 2 more vaccines, and now you have 8 that you need to give. You have 8 more vaccines you need to give. So that's where that wait list, that standby list comes in. We did start that list. People can go online starting on each Sunday and register. And I know that that may seem like a pain to have to do that each week, but keep in mind that we have had over 5,000 names in a week. And things will change each week. So whether or not you're available to come, if you're on that call list and we call you, we need you there safely in 10 minutes, right? In less than 30 minutes, because keep in mind now the clinic is getting ready to close. We're at the end of the day. We have volunteers and people there. So, and then you have to go through the process, which is pretty quick, but then you've got to wait at least 15 minutes, maybe 30 after your vaccine to make sure you don't have a reaction. So we need people who can get there quickly, safely, but quickly. So we will remain in terms of eligibility, but we also know that somebody may not be available this week at all. We don't want to waste time calling that person, right? So we want people to only sign up when they might be able to come that week. Some people may get their shot. They may have an appointment made. Maybe it's 2 weeks from now, but they're going to put their name on the list this week in hopes that they get in early. So we don't want to be calling someone and them saying, oh yeah, I got my shot last week. So that's why we are having people sign up weekly. The other thing for us is we will follow eligibility. So while we have not prevented anybody from putting their name on that list, we are following the state's eligibility in determining and sorting those people. So when we get that list, so on Saturday morning, for example, we will pull that list and see who fits that criteria and kind of start from the highest at risk to the least and provide those names to the nurses. And the goal is to prevent hospitalizations and death. So the people who are supposed to be at the top of the list, ideally are those people most at risk for hospitalization and death. Now, if we get in a situation where we have no option and it's waste a dose or give it to somebody who's 60 instead of 65 and over, then we might do that, but that would be a rare case. And we have not been really, with this wait list, we're not in that position, but it can be a little tricky. And kudos, I have to say, to Jama and all of the nurses and the team leads for trying to keep track of that, because as people come in, we're trying to make sure they've got enough vaccine to keep flow and keep things moving, and yet not have so much drawn up at the end of the day that we've got those extra doses. Because remember, that's sort of that cushion when you asked about, are we giving all of it? Well, we don't want to give out 100% of it today because you've got those extra doses. Those weren't appointments, right, that you were planning on. And so there is this sweet spot and balance. But I think I looked at it, 75% of our doses have been given, and the rest of that is really there waiting. It's got somebody's name attached to it, if you will. It's an appointment.
I might
Dana, have you seen many reactions?
Actually, no, we have not. In fact, the only things that I can even think of that we've seen at the convention center were the typical things where, you know, someone might feel just a little lightheaded after getting an injection, you know, which is not something that's any different than any other type of injection. You know, a couple of people have said, you know, I know that I tend to pass out after a needle stick. So we've got a couple of cots that we have them lay down on just as a precaution and lay down and get their vaccine. I think we've had one other person who also needed to lay down afterwards. But no, we have not seen any severe reactions.
On the previous subject, I might add that at the Medical Arts Building, at the end of the day, if they have extras, they take them over to the hospital and give them to people there. But they've had a total of, they've wasted a total of 3 doses. And two of them were on the first day. Excuse me.
Yeah, fortunately, we have not had to waste any doses. I've been the team lead every day that we've been open except for the last Saturday. And on Wednesday of last week, I believe was the first time we ever had to use the list. And we did call a few people in. That was also the day of the really bad weather. And a couple of people on the list didn't feel like they wanted to brave the weather to come out. So we kind of had to keep going down the list to find some people, but it wasn't bad at all. They were able to get there. We asked that they're able to get there within 30 minutes. And and we had that again on Monday, yesterday. I think we had to call 3 people from the list. I'm very careful at the end of the day to make sure that there aren't so many open vials that we have too many extra doses. So it's usually, I'm monitoring that last hour of the day very carefully as far as how many vials we have open, how many more people we're still expecting to come in for their appointments. And whether or not we have extra doses will also depend on if we have last minute cancellations. If we're expecting 5 more people to show up and then maybe because of the weather, you know, a few of them didn't, then we might have a few more extra than we had planned to. But so far it's working out very well that we haven't had to waste anything. We make sure that those get to somebody who needs them.
Jema?
Yeah.
You mentioned volunteers. Now at the convention center, how many actual jab givers do you have versus like and also, you know, I assume that there's more than just public health clinic jab givers. You're probably having some people from the hospital. How many jab givers at any given time at the convention center?
When we first started out, we had 3 and determined that we needed to beef that up a little bit. So we are up to 5 vaccinators now. And yesterday we had kind of some computer issues with the state opening up to 65 and over. It kind of overwhelmed the system, and we had a time period there where the computers weren't working for us and we had to go to backup paperwork, which kind of slowed the process down a little bit. So I jumped in. We do have 6 vaccinator stations, which is our capacity at the convention center as far as the space that we have. So,
right. And where are they, where are they coming from? Are they 4 of them typically from the hospital and 2 from the clinic, or how does that?
We don't have many, we don't really have any hospital employees working at the clinic. They're either through our public health clinic staff or volunteers, a lot of retired nurses.
Excellent. Okay, so
thankful to have them. I just wish there were more of them.
No, that kind of gets to what my question really is that you mentioned that this is sort of a recursive process, is that your allocation from the state through the health department is dependent upon your estimation of the throughput capacity,
yeah.
Right? So, you know, kind of if you had, the question would be if you have greater throughput capacity, i.e. more volunteers who are clinically credentialed to give the shot, could you then communicate to the health department, the state health department, that you have more throughput and get more allocation?
That's a possibility. The most recent information that I've heard from the state level is that the vaccine supply isn't as robust as they initially anticipated around this time. So even if we were able to increase our capacity, I don't know that the vaccine is available to increase that allotment. Now, that being said, I know that there was some information that came out from the state earlier today indicating that our allotments should be increasing by 16% over the next few weeks. So our capacity, like I said, because of the space limitations at the convention center, I think 6 vaccinators is all that we could manage. And we're pretty much at that capacity now, using all 6 vaccinators.
Now, the other thing that I will add to that is, if you haven't heard, so the university, IU, has offered not just to be a closed pod where they would just vaccinate faculty and staff and students, but be a public site. And so we continue to tell the state, as soon as they can push enough vaccine to us, IU is ready and waiting to open up a very large site for us. We also have businesses, including Monroe County government, that have employee health clinics that are on deck, if you will, to vaccinate eligible employees that they have. So to still roll that out following eligibility, but to be able to do that in those, what we refer to as closed pods. So they'll only see their employees, for example. But we're positioned and have plans that we could, if we could get the vaccine, we could have a lot more capacity. Even though we may not have it at the convention center, we could have it in other places. And the other thing that I would say in terms of volunteers, we have the largest number of volunteers we've ever had signed up, registered for a Medical Reserve Corps. That continues to grow. And I would say for every medical person, you need multiple non-medical people. So we do want people to remember that we need vaccinators and medical people, but we also need non-medical people. And again, the staff work in the clinic has been great. The volunteers are wonderful. We have nurses who are working their regular job and then coming in on Saturday to vaccinate because it's important. We've had a physician who comes on Saturdays after work to volunteer because they feel it's so important. And that's just a couple of examples.
So you might have heard and been tracking IU's point person on this, Dr. Carroll. And Dr. Carroll just had an article in the Atlantic magazine where he was highlighting the successes of the university, the Indiana University, in regard to COVID. And he was saying that they have the throughput, the ability. And I was thinking back to when I got my flu shot in the fall and how impressive that was. They had the Coliseum, the Coliseum set up, and my wife and I were through there so fast, and they must have had hundreds of people and probably 36 shot givers, jab givers, and so I would imagine that would be really kicking things in gear if IU could get that supply. And Dr. Carroll in this article in the Atlantic said that they fully intend to make this a community thing, not just a university associated throughput thing. So, when they have the supply, when they're ready to go, we're going to put the pedal to the metal in this county. I tell you what.
Yep, absolutely.
Dr. Carroll has been a real godsend to Monroe County and IU. I mean, he is really, his plan originally, he is responsible for the plan at IU, which was incredibly good.
Right. And by the way, he referred to us, the public health department, in referring to congregate living and fraternities and sororities in the Atlantic. So we got a mention in the Atlantic. Check it out.
Anybody have any other questions for Jama? Thank you so much.
Thank you.
Thank you, Jim.
Thank you.
Next.
Take care.
Next on our list is from administration. Penny, anything else you want to go over?
Sure, just a few things. I think I mentioned this last time and kind of hiding in the background here. Ashley, this is her last week as my assistant. Kate is joined us and they are in the background listening and taking notes so that minutes can be done. So welcome, Kate, and we are very much going to miss Ashley. We had a call response member who was offered another job and left us at the end of last week. Cass, we're very grateful for her work with us, and we lovingly refer to these positions as our complaint takers because they are the people handling the complaint line. So Aubrey joined us today to fill that position. So we're happy to have that filled. And we have another person who should be starting in the next week to fill that temporary environmental health position. And they will be really focused on COVID-19 response. And hopefully that will give Christina, our public health coordinator, a little break and Kathy a little bit of a break as well. So hopefully we will get these folks all onboarded in the next week and be able to kind of have a steady flow on that front for a while. I talked already about the wait list and the standby list and the volunteers, so I won't go back over that. The state did notice today on our call, they have received as a state 931,500 doses of vaccine. And we have over 259 vaccination sites in the state. More than 562,000 first doses have been administered and over 143,000 people have been fully vaccinated. So Indiana's really, this is an area that Indiana is doing very, very well in. We don't always fare as well in those kinds of things, but the state is definitely, they are pushing out and getting vaccine out to individuals as quickly as possible. And they have over 1.3 million appointments have been scheduled since the vaccine arrived. So we're doing good there. They did, as everybody knows, opened up eligibility to 65 and over. And I think part of that in terms of going 5 years instead of 10 is just that we have an immense demand for the vaccine. So trying to keep that, that group a little bit more manageable. And so as appointments are made, things are being watched, the groups kind of being taken care of, then they'll lower that again, I think to 60 and above. And then they'll be adding in whether they're looking at underlying conditions or what groups come next. The other thing this week was that the governor did put out a new executive order and kind of kept the public health emergency going through the February 28th. And just really change some of the criteria in terms of how the metrics are used. And so that's part of what prompted that, and the fact that we anticipate tomorrow that we will go to yellow on that advisory map. We've been at orange, even though our numbers have come down a little bit. Now, our rate, our number of cases per 100,000 is still high, it's still elevated, so that isn't reason to think that things are, grand, but it is improvement. We're happy about that. So that's why we felt it was important later tonight to just review and revisit the regulations to make sure that they are still what you want. We've got a couple suggestions regarding that. And with that, I think that probably covers it unless you've got questions.
Penny, have you heard anything else about the potential legislation that is going to be governing by committee rather than allowing local health departments to have the autonomy they've had, and the governor, I might add.
Right. I have not heard anything recently. We do get some updates. Several of those are in committee. I know that one of them, I don't think that they've had hearings yet. There may have been one. There is a slew. Normally we may have one or two things that are public health related. And right now there's at least a half a dozen, I bet, that affect public health in some way. So we're trying to kind of push those out as we get information on those. I have not heard an update recently. I know that several of them have went to committee. Margie just kind of put her camera on, so she may have an update about some of those as well.
I don't have an update specific.
Margie, you muted yourself.
Oh, sorry. Happy fingers. So I wanted you guys to know that the commissioners did sign a contract with a lobbyist. His name is Rick Cockrum. He's with Capital Assets. He's the owner of his own lobbying firm. And he used to be the director of the Association of Indiana Counties. So if you guys know about AIC, their executive director is David Boteroff. He was the former David Boteroff. So he's very familiar with county government. He also represents Lake County and Hamilton County. So he takes pride in representing the largest Democratic county in Indiana and the largest Republican county in Indiana. And he makes a note that we counties are a lot alike, except perhaps on election day, but our interests are the same. So he is representing Monroe County. I think you should feel pretty good about that. He's watching our interests at the state. I've been assigned as his sort of contact person, so I'm regularly, like daily or multiple times a day, getting emails and communicating with him. So if you have any thoughts about legislation that you would like to pass along, I'd encourage you to send it to me. If I get anything of interest, I am sending it to our whatever sort of stakeholders in the county that are interested. So planning, goes to planning, building kinds of things go to building. And if I get health related information, I will certainly send it along to Penny to send to you. So just let me know if you have any questions.
Thanks.
I think the main controversy gets introduced when the commissioners get crossways with the health department and the board of health in the counties. And so that may be, I think that perhaps here in Monroe County, that's probably not that great of a concern, for us. But, maybe we should just be on the lookout for if it goes to committee and there's going to be times that we should hear about that and ask, should one of our commissioners be a part of that, or, one of us maybe.
You're exactly right. And we have the luxury of having a like-minded board of commissioners and board of health. Some counties don't have that luxury. We are always, and one of the things that we stress to him is we want to protect our local authority to be nimble and to protect our citizens. And so the home rule powers are something he's really watching for us to make sure that we do whatever we can to not erode our ability to protect our citizens at the local level. So when things are in committee right now, and he's keeping me up to date on committee reports, and I'll keep you guys up to date.
I mean, the problem arises, of course, here in this state. We've had I think our governor has done a fairly credible job, mostly reasonable. I haven't agreed with everything he's done, but that's beside the point. He's had a fairly practical approach. But what if we lived in a state where the governor has taken a terrible approach to it and has virtually done nothing, and then we have no autonomy to do that? So I mean, it really. And then the legislature, we don't want them weighing in on every decision that the governor's trying to make, because rarely that works out well. So, Yeah, so I was just curious as to where we were and if we had someone speaking for our point of view, and I'm sure the point of view of many other health boards and county governments across the state.
Yeah, and again, I like to remind everybody when we talk about the subject that, you know, many of the public health laws and the early case law in the United States came about before we had a strong federal government. So these were things that were happening in colonies, you know, at the very beginnings of, you know, of America as we sort of know it now. But there were ships coming in from overseas that had malaria and yellow fever. And so the case law and the legislation that really cropped up about public health law started long before we had a strong federal government. And it was really left to local communities to protect their citizens. And so if you look at some of the, you know, old case law, it's really empowers local government to act on behalf of their citizens. And I hope that, you know, the Indiana legislators will kind of be informed about that and not sort of, they will let history inform them and not pass bad legislation because they don't understand. So we'll see. Stay tuned and we will call you guys. So be ready to get on a Zoom call to Indianapolis if we need you.
Okay, Penny, the strategic plan will be hopefully at the printer, and
Yes.
by the next meeting, we will hear something.
Yes, Sally has sent that to her final editor. And so hopefully in a couple of weeks, we will have that final version ready for your blessing.
Great. Okay, under old and continuing business, Security Pro contract amendment.
Yes, so you know that we, late last fall, signed the agreement. The commissioners agreed to assist us with complaint follow-up and going in and assisting businesses in compliance issues. So Security Pro provides the compliance officers for the department. The commissioners have agreed to extend this contract through March. And what this also does is the amendment is set to also allow us to use them for our vaccine clinics should we need security at those sites. So remember, at some point, we may be doing a drive-through or a very large pod, especially if we have one dose vaccine. That would be much easier. Some of our plans didn't include IU being willing to open up a public site, but even with that, we may need some security, especially with a larger crowd. So this would allow us to also use Security Pro for that if we need it. And I think, I'm not sure, Michelle, if Aaron or somebody from Security Pro is on or not. They were invited, and I thought one of them was coming, but I'm not certain.
I don't see anybody, but that doesn't mean I can't see everybody anyway.
So this would just be, you know, the commissioners have okayed it. This would also be you approving the extension as well.
Need a motion?
Yes.
I move that we approve the extension of their contract.
We have a motion. Do we have a second?
I'll second. George Hageman.
We have second. Cranner? We're up for a vote. Cranner?
Yes.
George?
Yes.
Narelle?
Yes.
Pritchard?
Yes.
Talukian?
Yes.
Wren?
Yes.
And I'll vote yes. So we have extended that, Penny. Okay. Next thing is a review of the board regulations. Do you want us to take it or do you want Margie to chime in?
Well, I think I can at first, and let's just say that the communal regulations, at this time, we don't recommend any changes to that. But Margie did make some just updates to the general language to that. We felt like it was prudent to also review it, go on record how you feel, that you feel like these are, if no changes are needed to be made right now, that we're still extending it so that people understand that we didn't set these regulations in November and haven't reviewed them since. So we don't recommend any changes to the actual regulations on communal living.
I agree with not any changes. What I would like to say though is that, and there's no time for these to expire at all. The reason I'm saying this is because I'm already getting questions about next fall from fraternities and sororities. And I said, I don't know what we don't know what's going to happen. We know what's going to happen. And so what I'm saying, just these have no expiration date. So I don't know how to tell them how to make plans past this semester. And I think it's going to be a huge financial issue for a lot of the houses. So I just wanted to say that.
Yeah, I know that even people with summer events are starting to ask, and I don't know what's going to happen next month, let alone
None of us
4
do.
or 5 months from now. So
None of us know what's going to happen.
Margie, anything you want to add to it?
No, I think Penny did a great job.
Okay. Anything you need from me? You don't need us to vote or anything. Anything else, Penny?
Well, actually, I would like you to adopt that with the new date, just so it's in the record that you've reviewed it. And same thing with the regulations, which I think Penny will talk about, just to make sure that it's clear in the minutes that you guys have reviewed these and accepted them and adopted them.
Okay, this is, do I have a motion that we have reviewed or adopted the updated the public health regulations for residential communal facilities?
Moved. So moved.
Second.
A second.
I'll second.
We have a first and a second. Cranner,
Yes.
Edgeman,
Yes.
Norrell,
Yes.
Pritchard,
Yes.
Talukian,
Yes.
Wren,
Yes.
and I vote yes. Was there another one, Penny? Was
yes.
there something about the gathering site or
Yes.
numbers?
So on the general public health regulation and the subsequent kind of health order, when we went to Orange, well, let me back up. The last health regulations that we did, we addressed kind of that color coding, putting in certain things during the metrics. So if we're in orange or red, that kind of went with the governor's outline. Then when we went to Orange, Dr. Sharp then, with the approval that he was given to do that, put in some more restrictive guidelines. So we moved our gathering size limit to 25, for example. So the recommendation is to take these, and they will stay the same if we remain in orange. When we move to yellow, and again, we anticipate on doing that tomorrow, then the gathering size would go back to 50. Now that's still half what the state would do. So we're still being more conservative, but we do recommend that we hold off a couple of weeks on making changes to events having larger than 50 people, and that we hold off on allowing bars to stay open later. You know, we've got Super Bowl weekend coming up. We've got a rise in our population coming as we speak. Yes, so we've got a lot of things happening that could cause a change. It could cause a surge. We've got the new variants. So we want to take just a little bit more of a conservative approach. So this would extend the order, raise the gathering size limit to 50 when we go to yellow. The other things would stay in place, and then we would recommend that you revisit it in a couple of weeks.
I agree with that. I think one of the reasons our county is doing so well is because we are a little more conservative than the rest of the state in terms of what we're doing, and it's working for us. I kind of like that. So I would agree with what you said and move that we accept those changes to the regulation.
So what do you need from us? Do you need us to also say we?
Yeah, we would need a vote on this. And I don't know if Margie has anything she wants to add, but.
Okay, Margie, do you?
No, I think that's great. Penny's spending enough time with lawyers. It seems like she's getting script down. She's perfect. I think that's scary, probably.
So we need a second.
You said it. I second it.
Okay.
Steve.
Okay, so we have a first and a second. Cranner,
Yes.
Edgerman,
Yes.
Morel,
Yes.
Pritchard,
Yes.
Talukian,
Yes.
Brien,
Yes.
and I also vote yes. Okay, that's all I had on the agenda. What about board member comments?
I just want to congratulate,
Anybody have anything they want to bring up, Dr. Brien?
just congratulate Penny and all the hard work she's done to get this going and be a role model for the state.
Here, here.
Absolutely.
Yeah.
Absolutely.
I also want to give a heartfelt goodbye to Ashley. I hope she can hear this.
Oh, yeah, we're really going to miss her.
Yeah, she's been around a long time, done a great job.
She
But I'm
has.
glad that she's happy and, moving on to other things. So good luck to Ash. And I'm sure that, who's our new one? What's her name?
Kate.
Kate. I'm sure Kate will be just as fabulous.
And Kate is a public health student. So we are happy to be mentoring and helping her in her public health experience. And Ashley has said that she's a quick learner and certainly seems to be demonstrating that in what I see as well. So we look forward to having her with us and being able to help her advance her career as well.
Would
Well,
she
she's-
be willing to come around and show herself?
Perhaps, Michelle, I guess we could ask Kate if you're willing to come on camera, then raise your hand and Michelle.
Oh, I thought she was there on site.
No, she is not.
Oh, okay, never mind. Don't worry.
Okay, we'll let you off the hook then next time, Kate.
And I did want to say the self-assessment that the board did. Mark and I have been working on the tally and the figures. We keep finding an error and redoing it, but we'll be sending that out soon too.
About a half hour before the meeting, I sent you the other evaluations, Kay. So
I saw that. I
Okay.
saw that. There's another one to add, Mark. Anybody else have anything? How about a date for our next meeting?
That is,
And happy Groundhog Day.
yeah.
you saw
I
a
know he
shadow.
saw his shadow.
Yeah.
Mhm.
Every day feels like Groundhog's Day.
I read a whole thing about groundhogs today, so I learned a lot of new things. It's from the Smokies. They sent me a thing about groundhogs.
39% of the time he's right.
Well, if you want to revisit it in 2 weeks, that would be the 16th, if I'm looking at my calendar right. Or you could do the 23rd.
I can't do the 23rd.
Totally up to, wait, and, yeah.
Well, can everybody do the 16th?
Oh,
Can do that.
what time?
4 o'clock time again?
Am I hearing a no from you, Steve?
Yeah, I can do it. Seems like like tonight, I had 3 board meetings back to back. I'm late now for the next one, so.
You know, it works for me that way too. My Tuesday starts out with 1 and goes all the way in.
I'm gonna do something about the other meeting, so we're gonna change it, so.
So let's say the 16th, does 4 o'clock work for everybody?
Yeah.
Okay.
Yep.
Okay, we'll say the February. Margie, how about you?
Yep, that works for me.
Okay, we're going to say February 16th at 4 o'clock. Thank you so much, everybody.
Thank you.
Thank you.
Have a nice evening.
Okay.
We are adjourned.
Thanks, folks.
And
Nice
write
job,
the
Kate.
date down.
Bye.
Bye.